Friends, today we're going to talk about why your beard isn't growing. Why do some men have a fluffy, big, shovel-like beard, while you only have 2 or 3 hairs, and it's incredibly frustrating? Are you looking for a solution? Today we'll sort out why this happens. Why did nature enrich some men like this and not others? We'll consider several explanations and, most importantly, what can be done right now to help you grow a beard. We'll also talk about the side effects of these therapies and evaluate them from a urological and andrological perspective, what the payoff might be, and whether it's truly safe to use certain medications to help a beard grow. Watch to the end. We'll cover the main points that can help you achieve a nice, thick, lush beard. Why do we even need a beard? Since ancient times, a beard was seen as a sign of masculinity and even wealth. In some early cultures, men wore false beards. For nobles or boyars, being beardless was considered shameful. If we remember historical Russia, for example, the boyars all had beards, a symbol of being a real man. People didn't know about sex hormones back then. They simply equated a strong, full beard with a strong, decisive character. Men with impressive facial hair were often perceived as stern and tough. If you caricature an archetypal villager in your head, you'll probably picture a man with a thick, big beard, not a clean-shaven face. Unfortunately, nature sometimes gives a beard to some people and withholds it from others. Some men have thick beards. Others have patchy growth. Many assume this is due to low testosterone. There is indeed a rare situation where critically low hormone levels impair puberty and facial hair remains sparse. But in the vast majority of cases, roughly 98% of men who worry about this, the reason isn't a lack of testosterone. It's genetics. So what can we do? Hair follicles are usually present, but many are in a so-called dormant state. That's why certain medications, applied to the skin where a beard should grow, can activate those follicles and stimulate growth. There are even surgical methods where beard hair is transplanted from the scalp. Do sex hormones and their levels affect beard growth? Yes, but this effect is often misunderstood and used as a kind of trick in online content. Hormones influence the speed and intensity of growth, not necessarily the thickness determined by genetics. Testosterone converts in the body to its active metabolite, dihydrotestosterone. Higher androgen activity can make beard hair grow more actively, but this does not automatically make it thicker everywhere. If there were a direct correlation between overall beard volume and testosterone, then every competitive bodybuilder would be overgrown like Chewbacca with only the eyes visible, but that's not the case. In reality, dihydrotestosterone promotes growth of beard hair while often contributing to scalp hair loss. So, yes, somewhere hair may start to grow more actively, but on the head, prolonged high androgen exposure often leads to less hair overall. Locally, in the beard growth zone, certain drugs can indeed enhance growth by activating follicles. Let's figure out what actually influences hair growth throughout the body. Vitamin D. A deficiency impairs hair growth. Exclude vitamin D deficiency first. Biotin, vitamin H, from the B group, often overlooked, but it affects follicle quality and hair health. Iron and ferritin. Iron deficiency impacts hair thickness and density. Ferritin should also be in the normal range. Some specialists use a rule of thumb that ferritin ideally correlates with body weight, for example body weight multiplied by 2, though exact targets should be confirmed with your doctor. Zinc. Deficiency affects sex hormone balance, including testosterone, and can weaken growth and follicle sensitivity. Vitamin E. Related to skin and hair health, deficiency disrupts follicle function. Vitamin A. Needs balance. Deficiency can cause hair loss or blunt the effect of growth therapy, but excess can also cause alopecia. Therefore, blindly taking vitamins without knowing your blood levels is not a great idea. If we're discussing a therapy to stimulate beard growth, uncorrected deficiencies can make it far less effective. If you decide to work on your beard, please make sure your labs are in order. You can do this either through my BioCheck project, the link is in the video description, or at any laboratory that can run these tests. These markers should be within normal limits if we're aiming for healthy hair, a healthy scalp, and proper beard growth during therapy. While we're at it, let's also touch on baldness. There are interesting studies showing that this isn't just a cosmetic toy. Hair is meaningfully associated with how people perceive health. One study found that men with hair loss, alopecia, and reduced beard volume are rated as less attractive, older appearing, less sexy, and bald men are more often perceived as unhealthy. Another study suggests people judge you in proportion to the quality and quantity of your hair. The relationship between hair status and bullying is striking. About 45% report bullying with moderate baldness and up to 79% with more severe baldness among peers. If baldness is present, what can be done? Two cornerstone medications are used: finasteride and minoxidil. What are their fundamental differences? Finasteride lowers dihydrotestosterone, slowing hair loss. There's research indicating an association between higher doses and a higher chance of sexual dysfunction. Dose matters. Minoxidil has an interesting history. It was developed as an oral drug for other medical purposes, and an unexpected effect was increased hair growth. It is now widely used for alopecia as a topical spray or solution, commonly in strengths of 5 to 15%. It works by increasing blood flow and improving follicle activity, a different mechanism than finasteride. Comparative research, see links in the video description, has reported effectiveness figures like roughly 80% versus 52% in some settings when a 10% topical minoxidil was used, but keep in mind they work by different mechanisms. Minoxidil improves microcirculation. Finasteride reduces dihydrotestosterone. Can they be used together? Studies indicate that combined use has a synergistic effect and yields the best results. Can already lost hair be restored? When hair has thinned, follicles have miniaturized, and shedding has occurred, is restoration possible? Yes, in about 66% of cases, according to research, meaningful improvement is achievable. People often ask whether 5-alpha-reductase inhibitors, like finasteride, are harmful to the heart. Some data show that aromatase inhibitors can worsen myocardial parameters even in the presence of testosterone, while with 5-alpha-reductase inhibitors, certain adverse androgen-related effects may be reduced. Another interesting finding: cardiac dihydrotestosterone levels increase after a myocardial infarction, and taking 5-alpha-reductase inhibitors can bring them back toward normal. Finasteride has been reported to reduce the risk of developing myocardial hypertrophy and interstitial fibrosis of the cardiac muscle. What is the optimal dose of finasteride when prescribed by a trichologist? Endocrinologists may be comfortable with hair-targeted microdosing, which is definitely not the higher dosing used by urologists for prostate indications. So buying a urologic dose formulation and taking it as is a bad idea. That increases risks, including prostate-related complications and the cascade of problems that can lead to surgical treatment, along with a higher risk of erectile dysfunction. If your doctor, whether a trichologist or endocrinologist, prescribes finasteride for hair, stick to the regulated low dose. Doses around 0.2 milligrams have been reported to reduce the maximal concentration of dihydrotestosterone in scalp tissues. Side effects from finasteride do exist. It's foolish to pretend otherwise. At higher doses, we've already noted the risks. Even at lower doses, some may experience erectile or ejaculatory dysfunction. As for minoxidil, although many think it only works locally, it does have its own list of side effects. In vitro, it can behave as a weak 5-alpha-reductase inhibitor, but its primary action is vasodilatory and trophic. There are different strengths. Many assume 10 or 15% must be superior to 5%, but higher concentrations tend to increase side effects more than clinical benefit. There's also oral minoxidil versus topical. Evidence suggests comparable effectiveness for alopecia, so topical is generally preferred to reduce systemic side effects. Let's say you've decided to grow a beard, consulted your trichologist and endocrinologist, have no contraindications, and understand the possible side effects. Practical options include topical 5% minoxidil alone or minoxidil combined with microdoses of finasteride if you have no contraindications. Typical hair-targeted finasteride microdosing would be up to 1 milligram, with many practitioners preferring even 0.5 milligrams or as little as 1/4 of a milligram. Alongside that, be sure to exclude deficiencies in vitamin D, zinc, and vitamin E. There's more. Several studies report that adding vitamin A within physiological limits can enhance minoxidil's effectiveness. Some papers suggest roughly a doubling of effect. However, remember that excess vitamin A can worsen alopecia. Stay within normal ranges for your blood work, that's critical. With adequate levels of vitamin D, zinc, iron and ferritin, vitamin E and balanced vitamin A, your minoxidil-based therapy is more likely to work as intended. I'm not a trichologist and don't claim to be one, but these issues overlap with andrology and endocrinology. Any trichologist should recognize when to involve related specialties, and any urologist, endocrinologist, or andrologist should recognize where trichology takes the lead. I don't perform hair transplants, but the evidence I've referenced today should help you make an informed decision and understand whether you're ready to accept the risks for the sake of a thicker, better beard.